Is it absolutely necessary to brush your pet's teeth? What does it mean when your pets have bad breath? Do pets get dental caries like humans do? We'll be answering these questions in the video today. Hi, I'm Dr. Ming Chang. I'm a veterinarian and welcome to my channel. I make educational pet videos to help pet owners worry a little bit less about your pets. So let's get started. The topic of today's video is about dental questions in pets, common misconceptions as well. And these questions you may not have enough time to ask your vet, or sometimes you may be too embarrassed or too scared to ask your vet. So let's get started. Question number one I get asked sometimes is, do pets get dental cavities like humans do, especially children who don't clean their teeth very well? So let's define a dental cavity first. And as you may know, all animals, including humans, dogs, cats, we have a lot of germs in our mouth, a lot of bacteria. And usually under normal conditions, these germs don't really cause us any harm. But we do eat every day, and sometimes we don't do a good job of cleaning off our teeth, which can leave food particles, food debris on the teeth. These are excellent food sources for the germs, and they can proliferate, they can form plaque as a result. Plaque can start forming acidic substances which can eat through our teeth. They'll start from the outer layer, which is the part of our teeth that's not alive, so we won't feel a thing when this happens. But severe enough, they'll continue to eat through our teeth and reach the pulp cavity, which is the part of the teeth that's alive, containing the blood vessels and nerves. And that's usually the first sign that we'll feel that we have a dental cavity. Now that we know what a dental cavity is, let's get back to our pets. Do dental cavities occur in dogs and cats? And the answer may surprise you, because it is actually very, very, very rare for dogs and cats to get a dental cavity. And there may be two reasons for this. Reason number one is due to the differences in the shape and position of our teeth. Human teeth are mostly flat, makes it easier for the food and plaque to stick to. And our teeth are bunched together. There's a lot of crevices for bacteria and food to hide in. On the other hand, for cats and dogs, their teeth are angular, they're sharp, so a lot less easy to cling to. And the teeth are spaced apart, so a lot less crevices to hide in. Reason number two is due to the differences in the food that we eat. Human food is usually high in carbohydrates and sugar and will readily stick to our teeth. Sugar is also the favorite food source for the bacteria. On the other hand, for cats and dogs, their food source is usually lower in sugar, so it's not as ideal for cavity formation. So, dogs and cats rarely get cavities. That means we can skip the toothbrushing, right? Unfortunately, that's wrong. Cats and dogs are very prone to another type of dental disease, periodontal disease or gum disease. What's the difference between cavities and periodontal disease? Well, for cavities, it's a disease of the actual tooth itself. And for periodontal disease, it's peri, that means around. So it's a disease of the structures surrounding the tooth, which are the gums, the tooth socket where the tooth sits, and the ligaments that attach the tooth to the bony sockets. The culprit behind gum disease is the same, high bacterial numbers. Our immune system doesn't like this, becomes irritated, and starts mounting an immune response, an inflammatory response. The inflammation can kill bacteria for sure and try to control the bacterial colonies, but at the same time, it'll damage our normal tissues. For example, the gingiva, the gums, they'll start becoming inflamed, be more red, bleed more easily. And it's not just the soft tissues, it's also the ligaments and the bone surrounding the tooth. They can become dissolved, leading to a very poor support around the tooth. So even though the tooth is healthy, its surrounding support becomes decimated and the tooth becomes loose. And this isn't just a localized effect in the mouth. As periodontal disease progresses, it can start affecting the animal systemically. The bacteria can enter the body via the bloodstream and affect the heart, the kidneys, the liver. And that is why vets recommend regular brushing and cleaning of your pet's mouth, as this is the best preventative for periodontal disease. So the next question is, how regularly should we brush our pet's teeth? And since plaque forms continuously, the gold standard is once every day. And if you simply don't have that much time, think of it as going to the gym. If you're going to the gym once every week or once every month, then that's probably not going to have a good effect and a good outcome. So at the least, try and brush your pet's teeth once every 2 to 3 days or 2 to 3 times a week. that'll still have a pretty good effect. And the last thing I want to talk about today is how we can detect periodontal disease. Are there any clues we can look for at home? And it's actually pretty simple. Simply bring your pet in, okay, face to face, and take a deep breath. And if you want to run away, if you want to vomit, then unfortunately your pet probably has moderate to severe periodontal disease. There's actually a correlation between how bad their breath is and how severe periodontal disease is, because the more severe gum disease is, the higher numbers of bacteria there are, and the more foul smelling gas they're producing. And another thing you can do is try lifting their lips and looking at their gums. Are the gums a slight salmon pink? That's more normal. And if they're afflicted by gum disease, they are usually more red, they look more swollen, and if you touch it softly, they'll bleed more easily. And please do not use your pet's appetite as an indicator, as a judgment call for gum disease. I have seen cats and dogs afflicted with severe disease. Their jaw nearly broken from bone destruction, and they were still eating normally. So remember, your pet's breath and your pet's gum color, those are better indicators. And if you do see abnormalities, take them to the vet. Do not at this time take out your toothbrush and start brushing vigorously. A toothbrush can only prevent gum disease. It does not cure, it does not treat gum disease. You'll need to have a veterinarian take care of that for you. So I hope you liked my video today, and hopefully it helped you answer some of your pet questions. If you have any questions or comments for me, feel free to leave them down below. Thanks for watching. I'll see you next time. Bye-bye.